welcome to this wonderful presentation that we are having from the Thrive East of the River project, which is a collaboration of 4 nonprofits and who are here to kind of speak and give us a presentation on uh, that how that initiative is proceeding, what they've learned, and what they would suggest to others looking to replicate this in other states, other areas. And I just want to turn this over for the presenters today to kind of introduce themselves. I wonder, Vaughn, would you go first?
Sure. Good evening, everybody. My name is Vaughn Perry. I am the Equitable Development Manager with the 11th Street Bridge Park, which is a project of building bridges across the river.
All right. And Mary, would you like to introduce yourself?
Hi, I'm Mary Bogle. I'm a Principal Research Associate with the Urban Institute in the Metropolitan Housing and Policy Center. I'm the Principal Investigator on this study, and my co-principal investigator, Elaine Maag, who will introduce herself in a little while, is also in the room.
Nice. Well, let's pass it over to Elaine to introduce herself.
Hi, my name is Elaine Maag. I'm a Principal Research Associate at the Urban Institute in the Tax Policy Center.
And Tracy, did you want to introduce yourself?
Sure. Hi, everybody. I'm Tracy Knight from Bread for the City, and I'm the Social Services Director. And I work on this project on Thrive on behalf of Bread for the City with some of my colleagues who are here and will introduce themselves too.
And Mandy?
Hi, my name is Mandy, and I am a MSW intern working with Bread for the City this year.
Great. And just to acknowledge some of the guests here with us, Melody Webb, did you want to introduce yourself?
Yes, hi, I'm Melody Webb, and I am with the coalition in DC that is seeking to bring people together citywide around universal basic income, and it's a project of Mothers Outreach Network, and we're really excited to be a part of this and learn more about DC Thrive East of the River.
All right. And Scott, did you want to introduce yourself?
Sure. Hey, good evening, everybody. My name is Scott Kratz. I'm the director of the 11th Street Bridge Park, a project of building bridges across the river. Great to be here.
All right. And I just want to turn this over to Reverend Wendy Hamilton to just kind of speak on what's happening in DC today, just so that we're kind of cognizant and acknowledge what's happening.
Good evening, everyone. And I thank you for inviting me to participate and just say a few words to speak to what's happening here in DC, in our city, in my city. And what happens here impacts the nation. And so many of us, myself included, have been captivated by the scenes that we've seen coming out of the Capitol today. Heartbreaking in many regards, scary. I'm still myself processing a number of emotions around what's happening, but I also understand that there sometimes has to be a breaking down before there can be a building up. And so while I am acknowledging how this is still a very tense situation, I just want to take a few moments tonight to just say that, yes, I am praying for our nation. I'm specifically praying for our city. I am happy to be on this call because it's movements such as these that are going to take us into this next phase. I think what we are seeing play out on our television sets tonight is more of a dying off, if you will, the death throes of the old us and the rebirthing opportunity for the new us. But in order to be rebirthed, we are going to need to have programs like what East of the River Thrive is providing. I'm so excited. I'm in Ward 8. Ward 8, stand up. That's where I live. That's my home. That's my home ward. And so I'm grateful to listen to what they are bringing to residents of Ward 8. And that's hope. That is hope. And it's the seeds of programs such as these and Melody Webb, Mothers Outreach Network, trying to duplicate the same thing. This is what America is ultimately about. This is what we stand for. This is what we represent. And so I am grateful to each and every one of you that even on a day like today, you all still said, nope, we're still going to meet. We don't want to cancel. We are going to continue ahead because this is ultimately who we are. So thank you all. I will continue to pray for each and every one of us, especially this city that I love so dearly. And I know that with programs such as these, modeling the way for others, we are on our way in the right direction. Thank you.
All right. So turning it over to our presenters.
Thank you. I just need to take in those words for a second before I start through the presentation. Thank you so much, Reverend Hamilton. I needed those words of inspiration. So if you all could just give me a moment to just take that in. I went to bed with a lot of hope and I woke up with a lot of hope. And throughout today, I felt like it was leaving away from me. And so it's good to be able to recenter my perspective and around and not lose sight of all of the amazing things of the fact that a Black man whose mom picked cotton, right, was elected to the Senate from deep South Georgia. So let's not lose sight of that in all of the chaos that we are seeing today. So thank you so much. I needed that reminder. Thrive. So we are so thankful to be able to share with you all today. The Thrive Partnership is a collaboration of 4 Ward 8 nonprofit organizations, Bread for the City, 11th Street Bridge Park, Far Southeast Family Strengthening Collaborative, and Martha's Table. And I want to point out that we were intentionally looking at ways to work together prior to COVID even hitting, right? We say we have these amazing organizations. What are some ways that we can pull our collective resources together, whether it was social power, whether it was financial power? What are ways that we can bring these collective resources together and in a way that could really benefit the community that we so love and care about that much more? And then COVID hit, and we were like, wow. And we had some early on conversations around universal basic income, and Martha's Table had somewhat been, looking at it. And I had an opportunity to travel to, oh my goodness. Where did I go?
Stockton and Oakland.
Thank you, to California. Good. COVID has messed my brain up. So thank you, Scott, to Stockton and Oakland, California, to learn about their universal basic income programs. And so when COVID hit, we said to ourselves, here's something that all of us can, focus our collective efforts around. And what we did was create a proposal to demonstrate what a national rapid response and resiliency model for families could be that have really been hit hard by COVID-19. Next slide. And what we quickly realized is these are some of our partners. I'm not going to go through that list. I do want to mention, I listed the 4 of the organizations, but I would be remiss in not mentioning how important it was for LISC DC to be a part of these conversations and kind of help to shape what exactly we would be doing. Urban Institute, at least with the Bridge Park, we have been working with them for at least the last 4 or 5 years really looking at the importance of data collection and measured goals, because we believe what gets measured gets done. And as we were looking at this to pilot, we wanted to have the data from the beginning all the way through the program so that it could be something that could not only be used across our city, but it could be used as a pilot across the country. Next slide. And so one of the things that we quickly learned was COVID was only exacerbating a lot of the issues that we were already facing in our community. You know, some of the points that you see here, 89% have experienced a negative financial impact on their families as a result of the COVID crisis. 58% who were employed, or 58% who are employed, were no longer being paid by their employer. Ward 8 is third in incidences, but number one in deaths, right? And so they already had a lot of issues in these communities. There is already a huge disparity, whether it's in health, whether it's in education, whether it's in healthy access to food. And so all COVID did is just further exacerbate a lot of the issues that we were already facing in these communities. Next slide. And so the overall goal was to really address the danger posed by COVID-19 to specifically the Ward 8 community, and how we could increase long-term economic stability and mobility. In other words, we didn't just want them to survive, but we wanted them to be able to thrive, both during and post-pandemic. And we had three goals. How can we, one, alleviate the crisis? How can we support these families in stability? And then how can we also be able to, foster them to be mobile? And so it was really important for us to think about what our values were as a collaboration. And I mean, I would share, I've been a part of a number of collaborations over the last 10 years. This is by far probably one of my best experiences working with, in a collaboration with multiple organizations. And I might be preaching to the choir right now, but like oftentimes when you find yourself working with other partners, like folks can tend to have their own agendas and like they're working together, but they want to get the credit. Like none of us cared about the credit. Like the ultimate goal was we wanted to be able to have as much impact in our community as much as possible. And from the very beginning, from the executive directors to the staff, everybody was in line with that mission. And some of that, I believe, was because early on we had decided like these are the values that we are going to operate by for this collaboration. Number one, valuing the power of residents to make their own decisions, right? I can't speak to that enough. When we start to talk about equity, and we talk about, when we're talking about impoverished communities, they want to be able to have the power of choice, right? Not you giving them some money and telling them what they have to do with it, but allowing them to have it and they can make the choice. Like we trust that they are going to make the right decisions for their families. We don't need to make those decisions for them. And so part of our thing was like, no, we're not going to tell them how they need to use the money. They can use it however they need to use it. Second point, we want to treat our community with respect. Right. And so we want to treat them the way we treat each other. We're not looking down at them. We're not looking at them like we're coming in to save them. We want to work with the community and we want to say what are ways that we can support you? And here are ways that we can provide resources for you. We always want to act with integrity. I can't mention that enough. How do we act with integrity amongst each other? But also how are we acting with integrity as it relates to externally, you know, with our community residents. And are we making sure that we are doing what we say we're going to do with these resources and with these funds? And if we don't get it all right, we can own it and be like, you know what, this is a pilot. We didn't necessarily get this right. Thank you for your feedback. We're going to use this feedback to improve this model so that somebody else doesn't have a negative experience. And then finally, we believe in a racially and economically equitable community. You know, what are ways that we can pour into resources in communities that have been historically neglected and marginalized? Next slide. So the program design pretty much looked like this. We were offering cash transfers. So it was a total of $5,500, and families could choose whether they wanted to receive a lump sum of $5,500, or they could choose that they wanted to get $1,100 per month. It could go directly to your bank account, or if they didn't have a bank account, we would provide them with a debit card, and they could get it on their debit card once a month. We are also providing them with groceries once every week. The way that we are delivering those groceries differs per organization. So some folks, they actually have to come to the site to pick up the grocery. Others are actually having it delivered to their homes. They also get household goods once a month. So things like toiletries or cleaning supplies, paper products, batteries, Tupperware. There have been a number of different things that the people that are participating in the program have been able to take advantage of, you know, with those household goods. And then finally, our family navigators. And so the Far Southeast Strengthening Collaborative already had a number of different resources that they offer their families. And so what we did was, for the families that wanted to have a navigator connected with them, they could sign up for a navigator, and those navigators will almost act as caseworkers to, you know, see were there additional resources that we could provide to the participants that maybe they weren't getting, you know, through the cash transfer of the grocery or the household goods. Next slide. Am I?
No, I think this is me, Vaughn.
It's over. Okay.
Yeah, I think this is me. So when we began, you know, when the four nonprofits came together, as Vaughn mentioned, even before COVID hit, we knew that this was an opportunity to provide cash directly to the families that we serve. And we started by, and with different nonprofits, sharing funds and sharing funders can be really tricky, right? And yet that really wasn't the case for any of us. I think all four nonprofits really opened up their doors and their Rolodexes for and their contacts, where we all came together along with our colleagues at LISC and our colleagues at the Urban Institute, and pulled together a larger spreadsheet, a Google spreadsheet that we could edit it in real time, of who would be a potential funder. And then we asked ourselves, who's the best contact? And it's like, okay, well, I know this foundation, I know this individual, I know this corporation. And so we split up that sort of list of responsibilities based on who those contacts were. And one of the things that was really clear, two of the things that were really clear from the beginning was, one, we wanted to make sure that we were telling we were all individually sharing with the funders that it was not a choice to either fund the operations of the individual nonprofit or fund Thrive. This was an and, right? And that was really important. And we really had the funding community, the philanthropic community, really embrace that. And two, we also made a choice not to allow the funders to choose which part of the program they wanted to fund. They were either in or they weren't, right? Because several funders said, well, we're not comfortable with the cash transfer. Can we fund the dry goods, or can we fund the groceries? And we're like, you need to be in for this entire thing. We also had it was really interesting, you know, I think this is less the case now, although we still get a little bit of this pushback, but we certainly had pushback from funders early on who were a little uneasy at providing completely unconditional cash to our participants. And so we had to walk our funders through our core values, that this was about respect and this was about trusting the residents in our community to make the right decisions, right? And ultimately, I think every single one of the funders who had some reservations end up donating. We pulled together all of the nonprofits, and Urban and LISC pulled together a short sort of 3-pager overview that we could send to funders. From the beginning, and this was, and we pulled together a pretty ambitious goal. We pulled together a goal to serve 500 families, and pulling together the budget that was a little more than $4.1 million. We had Kim Ford, the executive director of Martha's Table, kept correcting me, and instead of saying if we raised this money, it was when we raised this money. She was completely confident that we could do this, and lo and behold, in a very short amount of time, we've been able to raise $3.7 million, all from private sources. So we started with some funding, some really key funding from some individuals. A family made a $50,000 contribution. Another family made a $200,000 contribution. We received some funding support from the Greater Washington Community Foundation, and then it really snowballed. I mean, once we had about $300,000 or $400,000 where we knew that there was real strength behind this, we were sort of off to the races. Corporations then, particularly the banking community and financial institutions, provided additional dollars as it was clear about the depth and breadth and impact of COVID. And there were starting to be some specific dollars for COVID relief that was coming in from lots of companies, but particularly from the financial institutions. And then in June, we set up a website to take in individual donations, which you can find at bridgepark.org/thrive. And we found that the individual donations really spiked when we received press. And so we pulled together, particularly we had a Washington Post piece in June, and within 3 days, we had $37,000 that we received directly from the website. So we pulled together a larger communication committee, a comms committee comprised of all of the different partners, and really went after all of the media. Thank you, Mandy, for putting that in there. And then lastly, and then perhaps I'll turn it over to Tracy, who might be next, but providing regular program updates to all the funders have been really important, keeping them apprised. So we send an update about every 2 months. When we get new media, we send it out to all the funders. We send out a constant contact email blast to everybody individually who's donated to make sure that they know the kind of impact that we've had. So we send links to all of the Urban Institute reports that come out and any new news. So I will turn it over to the next person.
All right. Thanks, Scott and Vaughn. So yes, so we have an ambitious goal of enrolling 500 families. And so this is just a little bit of information on where we are so far. So we had 11 rounds. We decided to break this into rounds or periods where we would recruit, enroll, help people get set up in the financial system, which I'll talk more about, and then actually get their cash transfer money. And so we broke it down into these rounds. We started off without much structure to those. We just would sort of, when we felt like we had enough people, we would go ahead and sort of close the round off and then move people in through the financial system. But over time, we realized it was really better. It was just a lot easier to have well-defined periods for these rounds. So we moved to twice a month, right? And so we just sort of moved to this place where we closed a round, twice a month. And that gave us a couple of weeks to move through the enrollment of each participant, get them through the financial enrollment piece, and then on. And really the enrollment was sort of two-part, right? So after we recruited people, And I think Vaughn mentioned a little bit, we all decided in the beginning that we wanted to enroll people who already had relationships with our agencies. That did not necessarily mean that they were a traditional client or patient. It could just be that, they had a relationship with us through advocacy work or, just some sort of relationship. And so we identified those folks, and then it was a two-step enrollment piece. So Urban Institute helped to create the actual enrollment where we collect people's information, get them into that system. And at that point then, and I'm sure, Mary and Elaine can talk more about this, but, figure out if people are going to want to give consent to participate in the research part of this project. And so for people who want to participate in the research project or the research part of this, there was some additional work that we did to move them into the Urban Institute system. But certainly people did not have to or do not have to participate in the research to still be a part of this. They can say no to that, and then they just continue to get all of the pieces of the program, the cash assistance, the the food, the dry goods, the care management support that Vaughn mentioned, without being part of that research study. So we did that, with these 353 people. And then the second part of it was to also go ahead and get people registered in the financial system. We partnered with a group called FII, Financial, oh goodness, Independence Initiative. And they have been a really great partner in helping us figure out the first steps of this project. And I'll talk much more about that in another slide or so. But that was the sort of the two-step enrollment process. And again, we broke that down into these 2-week cycles. So we are just shy of 2 million. We are looking forward to enrolling our next, 150 people as soon as we have all of that squared away and reaching our goal of 500. So the next slide. Thank you. So a couple of the early challenges, really off the bat, the first challenge we came upon before we even started was, what impact is this money going to have on people's safety net benefits? Medicaid, TANF, SSI, food stamps, all of that. We had some conversations with some of our benefits leaders in the district, the DC healthcare finance folks, and everybody was supportive and wanting to help us figure this piece out. But we just hit some challenges where the policies were not where they needed to be in order to exclude this as income or asset. And so we changed tack a little bit, or rather just put that on hold for a moment. And we talked with our public benefits attorneys at Bread for the City and got some advice from them. That then led us to also a partnership with our local DC Legal Aid Society. And so between our Bread for the City's public benefits attorneys and some of the attorneys over at Legal Aid Society, we were able to offer each of our participants the option, certainly not mandatory, but the option of having a one-on-one meeting with a public benefits attorney to just discuss their unique financial situation and really determine, how would this money, either in the lump sum or the monthly sum, how would that impact their benefits so that they could make an informed decision about whether or not they wanted to participate in the program. And if they did, again, which of those, lump sum versus monthly sum would be in their best interest. So that's sort of how we decided to mitigate the public benefits challenge. But, that is definitely the piece that I think we are all really wanting to address, in our dreams of being able to scale this program up. That is certainly something, a wall that we believe we're just going to continue to hit until we find a way to, have this income not counted as income and asset the way that it is counted now. So that's one of our early challenges, and one of the ways that we tried to work around that a little bit and make sure that our participants, could make an informed decision. So another area that we are still sort of figuring out is this funds transfer system, right? How do you actually get cash to people? As Juan mentioned, we went into this offering the ability to have the money just direct transferred into people's existing bank accounts or put on a debit card that they can use. Of course, you need some sort of a financial mechanism though to get it there, right? And so we partnered with FII, the Family Independence Initiative, and we partnered largely with them because we share the same values. They have a very similar mission. We believe strongly in individual agency, independence, an ability to we make decisions about our money, right? And we believe that everyone should make decisions about their money. And so one of the challenges though that we've had working with them is they have a system, a computer system, right, where you have to receive a code and then go in and access your code, and there are multiple steps. And so for some of our participants, that was no problem at all. And for some of our participants, especially some of our older participants who were just not as internet savvy, it did create some real challenge for them. And so we found that as on the agency end, we had to provide a lot more support to those folks who were really having a hard time navigating the technology piece of that cash transfer. And so one of the things that we're going to be exploring in a couple of months is we still have some people, some of our participants are still enrolled with FII through the monthly payment. And we are going to continue to work with them and support our clients and work with FII on that. But we are also offering now that new participants, new enrolled participants can actually work directly through Bread for the City. Bread for the City has a representative payee program. And so we already have some processes in place, to be able to move funds onto debit cards for people or directly into their bank accounts if they want to go that route. And so we're gonna go ahead beginning now in January and offer that to our participants. And I think that is going to be one of the something that we're looking forward to see what works better, right? We're still very much, this is our pilot, and we're trying to figure out, what sort of, financial technology mechanism is best for the participants in this program. So we're looking forward to that, and we'll certainly share what we learn as we get more information. So, right, and just in general, the technology access, that is something that is super, super important that we're exploring. What else? What's the next slide? Yes, so some of our early lessons learned. So again, just a huge, huge need for public policy, public benefits policy advocacy. I really can't stress that enough. I think, we can figure out how to get money to people. We can figure out how to provide, the various supports that people need and people want. But really making sure that we don't harm, right? We don't want these programs to cause harm. And we want these programs to matter, right? I was in conversations with a different group who was talking about some cash transfer, and it was a smaller amount, I think around 500 or so. And, as we were having this conversation, and at the end of the day, for some of our participants who are receiving TANF benefits, it was a complete wash at the end of the day. It's, they would have gone through the trouble of, having to report things and have things cut off and get back on them. And really for, at the end of the day, about $10, right? And so we want to make sure that this money is not replacing, the benefits that people are relying on, but really adding to, right? That's the whole point of this. People need more money, not the same amount. And I think when it comes to that, we have been most concerned, of course, about Medicaid, because even with a benefit like SSI or TANF or food stamps, we can know what that amount is. right? We know that exact amount, and so we can make an informed decision about, whether it is worth it or not, to potentially lose that benefit. But when it comes to our healthcare, we are very aware, of what could happen if someone's Medicaid benefits are harmed, and so we want to make sure that we are administering these programs, respectfully and safely and appropriately for everyone. So yes, so public benefits policy advocacy, and yes, Melody, I am so excited, that our agencies and organizations and projects have found each other, and I'm excited to work together. And so I've already talked a little bit about the need for, easy technology for that cash transfer process. But the other thing I'll mention about some lessons we've picked up on is, as both Vaughn and Scott mentioned, this really has been a kind of a dream group of agencies. It has worked so smoothly. And I think that has also allowed us to think a little bit about, we went into this with this idea that, Bread for the City we would identify and recruit people who had relationships with us. We would enroll them. We would manage the cash transfer enrollment. We would do each of those steps ourselves. And certainly we want to take advantage of the relationships that we have with people, right? We know how important relationships are, but I think the success of this partnership has also shown us that, each of our agencies, though, we also have our own, we have our own unique stuff, right? We have things that we each do best, right? And we can really, really partner with each other and really take advantage of each of our areas of expertise and pass that right along on to our participants. So, sometimes as we talk about, will there be a Thrive 2.0? What does this look like if we get to scale this up? It has really opened some really great opportunities for how can we take full advantage of again, each of our agencies' areas of expertise and share that with our participants. So that has been really, really exciting. So that's a little bit of sort of some of our challenges, where we are with enrollment, some of our lessons learned. And I think this is where I pass off Mary and Elaine to you guys for some early findings.
Yes. Was the first slide? I think we may have skipped this slide that just sets up program evaluation. Is that still here, Mandy? Yep, there it is. Basically, we have a team of about 6-7 researchers at Urban working on this, and we're doing several functions, and it in some ways mirrors how Urban got into this in the first place, which was through some work we've been doing with Bridgepark on equitable development, and it's the implementation and outcome study for them on their Bridgepark infrastructure reuse project, which will and is affecting Ward 8 along with some other projects going on. So they're trying to get ahead of the curve on any kind of neighborhood change there. And we've been playing 2 roles in that project, and it's very similar to what we're doing for Thrive, which is we have a continuous improvement feedback loop component, and we have also a final evaluation. If there becomes a Thrive 2.0, it'll be an interim evaluation on the way to other evaluations where it's much more of that classic outcomes research. But our rapid feedback loop, and it's nice to put the 2 together. We have some mechanisms internally to make sure we keep things very objective. But at the same time, we like to be close to the data. We like to be involved in the conversations. It really helps us to understand what's going on. So that comes out in the rapid response feedback loop, where every month, one component of the project is that we deliver, and it's really not so much every month, it's been according to when the data is coming in appropriately, what we're calling a memo. It's really a brief. The first one dealt with implementation. I'm going to share some of the results from a demographics and participant composition memo we are about to release to the partners. These are internal feedback loop memos that they can use to improve what they're doing. The next one is going to be on fundraising. So a lot of what Scott was talking about, we're going to go deeper on. The next one after that, Elaine's leading up, which is the systems response. It's going to get a little bit more deeply into some of the things we're seeing in terms of the benefits impacts. And the final of these internal memos, these rapid feedback loop response memos, will be an early look at participant outcomes prior to when a few months later we'll publish the final report. Accompanying each of these reports is typically some public facing blogs. And at the link Scott sent you, you'll see there are 2 blogs so far that I've written. One goes over in a bit more detail some of what Tracy was just telling you about in terms of the differences in the agencies and the different roles that they're playing and what happened at launch. The second one I wrote gets into very much, it's more of a, and this is one of the nice things that Urban can bring to this, is it's got some sort of policy analysis in it of what is it we're learning. And certainly we're learning from Stockton and other groups that you guys all know about too. But what have we specifically been learning through the Thrive evaluation already about cash-based social policy? I would say, and on that topic, I mean, I was very moved by what Reverend Hamilton said at the beginning of this too. And I think one of the silver linings, if there are going to be any in the pandemic, is, and this is going to be discussed more in the fundraising memo we're about to finish up as well, is how rapidly things like guaranteed income and UBI are being, how much more rapidly those are being embraced as people see the need. And I think a lot of the racial equity discussion and unrest we've had this year drove a lot of funders to know that this investment in Ward 8 families made the most sense for them. And again, when I show you some of these findings about composition, I'll talk a little bit more about that. Within the rapid response feedback loop, one of the things that I'm really proud of is that we're also training up community researchers, people who live in Ward 8, who for one reason or another, in a couple of cases, they used to live in Ward 8 and they've been relocated temporarily as their housing is being renovated, and they'll be brought back. It's sort of this classic revitalization story. And we have 10 community researchers, and we're working with one of the partners, Far Southeast, to train them and have trained them. They're a wonderful group to do the qualitative interviewing with us, and they may help us with other aspects. And in terms of the Dream Team partnership, Tracy and I and our team have worked together to get one of those lawyers at BRED to even advise the group of community researchers. We're going to have, I believe it's tomorrow afternoon, a workshop for the community researchers so that they understand when Urban pays them, and we're paying them a wage as consultants, does that have an impact on what may be their benefits? Because those folks are also, and we're seeing what we think may be an intermittent work story going on under the surface of some of the data. They've, have income coming in, and does the addition of Urban's, it's a customized question for each person. I mean, that's part of what Tracy was alluding to, is that you have to look at it on a case-by-case basis because not everyone will be impacted. But it's lovely that we can turn to BRED and say, hey, you got those lawyers? Can you help us out? And sure enough, we're in it together, and this team will be the team. I've already had other agencies in Ward 8 come to me looking for, to find out more about, is this a team that Urban can continue to supervise with Far Southeast in the mix? And, the backup BRED of things like supports from BRED on legal stuff to sort of build up the sort of community engaged research methods in this. And I think that's walking a walk of this project even more beyond the cash transfer aspects, is here's a job. I can see a couple of community researchers who might even be people who want to develop this as a career for themselves. They're already showing some real aptitude for it. The third thing we're doing, besides the feedback loop and the impact findings, the outcomes finding studies, we would want to, and it goes to this conversation, disseminate an adaptable blueprint. We're expecting that we will raise the full amount. I think Scott touched on this, but everybody gets paid after the families, and that's including Urban Institute. So we need to reach the full funding goal to have enough money to do the blueprint, but we think we're going to, and we want to make it work in any case, because it's really important information we think we're getting on both the implementation impact side. So next slide. Okay, so here's some of the emerging findings on Thrive composition. I will say that I'm not going into a lot of our implementation findings because a lot of what has already been talked about in this call comes out of the implementation research, or, you know, it comes out of the heads of the folks who are running this as well. I mean, we interviewed a lot of those folks, so there's sort of a back and forth on that. But a lot of the lessons learned and the challenges that have already been discussed, we've documented in our internal memos, and will continue to document in our public facing work, as well as the final report, which should come out in midsummer sometime. But we are doing these blogs in the interim. What's hot off the presses here, sorry, my screen may have gone blank. What's hot off the presses here for our, I have to go plug in, for our latest, the team on the phone call hasn't even seen these findings yet. You guys, this is like a big reveal. You guys are seeing it first. Let me make sure I'm backlit. No, I'm sorry. This is such the modern Zoom situation. Home meetings. But is what we're finding is in our work, and I'll show you a table briefly. I can show it again if you want next. But so the Thrive participant composition, there's about 3, it's in the next table, the total enrolled so far is 353. We've already talked about that. And they're generally similar to the overall Ward 8 population, but more likely to speak English as a primary language and identify as female or Black and live in larger households. We're seeing pretty significantly larger households. And in general, that goes to another thing, is that the participants appear to be a lot more vulnerable than even others, their neighbors in Ward 8. And it's an interesting, can you take Lucy? My dog. What's interesting here is that, and this gets to the universality versus a guaranteed income. I mean, I think one of the things we're going to be thinking a lot about at the Urban Institute is how do we talk about the cash relief? And I saw one of the participants talking about this earlier in the chat feed, is there's a 50% AMI cutoff, and we can see in the 50,000 range, there might be a few people who are in Thrive, but most of the people, and again, I'll show you those stats in a minute, are close to half of everyone in Thrive or make an income in 2019 of under $10,000, which is far greater than the average in Ward 8 even. And they tend to have more very young children and school-age children. But again, the very young children, the 0 to 5 pool is larger on average. I think what that goes to, and I know Compton's using the same model, I don't know as much about how Stockton recruited their families, but because these are sort of like convenient samples almost, the different agencies are recruiting very different groups. They're recruiting from the folks they serve. So this is documented in one of my blogs as well, is that B-Bar and Bridge Park are recruiting from a housing complex that they are involved with. Red is recruiting from its medical clients and some folks involved in an advocacy campaign. Martha's Table is recruiting from a lot of early childhood participants that they have. Far Southeast traditionally serves a very low income population. It's a family strengthening collaborative. So they're working with people who come to them because they're really having some challenges in their lives. And that's showing up in what we see in the composition. So it's interesting because you could have it, you could say it's nearly universal because 50% AMI in the region is a little bit over, you know, it's like in the $55,000 range for a family of 4 in the Washington D.C. region. And we, you know, if there's even a few people over 50,000, and we don't see that many in the data. What's interesting is that this is in effect universal in that sense, but there's still this income means tested cap notionally. And yet, because you're going through these very highly reputable organizations who have this these populations who really have their own challenges and they're working with them, they're recruiting. It's like targeted universalism. I've been thinking about that a lot. If folks know that term, is there a way to offer something to everyone so that it's truly universal, but make sure that you're getting first to the people who need it most or need it more? In the recent blog I wrote, I talked about an ideas out there about universal basic income plus, where you might add to a UBI for families experiencing disparities like African Americans. That would be a good example of targeted universalism, where you would take some funds and add a layer on top. And I think that's a very interesting concept. And we might even be seeing sort of a natural experiment going on here in the Thrive, given this composition data we're seeing. Under half of Thrive households, but it is just under half. So there's a lot of workers in this group, about 50%. I just saw something about, do we have a data on a control group? We're going to be comparing to the Pulse survey. We have 3 surveys going. I'm glad you asked that, Catherine, because we have 3 surveys that we're running and qualitative data we're collecting. And so we're not doing a control group per se, but we will be comparing these numbers to the Pulse survey, which has been going on during COVID through census. The other thing we know is that most common income source is SNAP benefits. For a lot, 3/4 of Thrive participants are receiving Thrive or receiving SNAP. And there's sort of a mystery here. We're loving these questions already, and that, and Elaine could speak more to this because we've been talking about our hypotheses about this. We see that there's a pretty high uptake in the economic impact payment, 80% of Thrive participants, but only 10% are receiving unemployment benefits. And we find that interesting. Now that nearly half of Thrive households working at time of enrollment, there could be an essential worker story going on here. There could be an intermittent employment story going on here, where people have come up and they got their check. We'll be curious to see how many people actually hand enrolled through the website that the Treasury set up. But if they got the EIP, why aren't they also getting UI? Did they not lose their jobs? Did they have a job before, but it's intermittent work, so they weren't eligible for they were eligible for EIP, but they're not eligible for UI. So that's something we don't know yet, and we're mining out the data on now. And that'll be an interesting story. So next slide, I'll just show you this real quick, and then we can move on to questions and things. This is a table from our upcoming report. I know it doesn't work well as a slide, but it literally is hot off the presses, so I just put it in here. But you can see there's 305 folks consented. So there's 353 enrolled so far, but 305 consented to participate in our research, which is a very high consent rate. We've had a very high response rate to the first survey. You can see the generally larger size of the households. Families living with children is, there's only 38% of families in Ward 8 are families living with related children, but 77% of the families in Thrive are living with their children. You can see again, when you look at the 0 to 4 and 5 to 13 age ranges, how much it skews in that direction for Thrive. And then again, most notably, you get into the household income percentages, and it's really pretty striking how many Thrive folks are at the very bottom compared to in the less than $10,000 range, even compared to other Ward 8 and Ward 7, which is our two wards in DC that are disinvested, have some historically high rates of poverty. And certainly this group far exceeds what people in DC experience in terms of low incomes. So I will leave it there for now and take questions. Elaine and I can take questions later because there's a lot that we know and could go into even now.
If folks have questions, if you want to raise a Zoom hand, and I'll just start with kind of a couple that we knew we were going to have coming into this, which was, you know, how did you all find each other to work as partners, and kind of related to that, for folks that are trying to look at doing this in another market, are there conferences or, you know, places where, you know, we might find agencies such as yourself who would be kind of good experienced partners to participate in this kind of work? And, you know, also related to that is, you know, what is the research space that's kind of looking and mapping at all of this, like, just so we can find this network that you're all plugged into, where we might be able to replicate this elsewhere.
I can maybe take a stab at that first part of it, because there are a few questions that were embedded in there, which is great. I can start with the first one. How do we find each other? All of the nonprofits have known of each other, or known, like I've known George Jones, who runs Bread for the City, for years. George and I have been trying to figure out like how to play together and how to partner. I've known Dion, who is the executive director of Far Southeast Family Strength and Collaborative for a long time. We were working and partnering with Martha's Table, and they had a shift in their executive director, and Kim Ford recently joined in the last couple of years ago. And Kim and I have been trying to get together for quite some time. And so Kim and I finally met last summer, or I guess a summer ago again, about a year and a half ago. And it was interesting. Kim and I, we have for the Bridge Park, we have a target area of about a 1 mile walk shed around the park. Kim broke out her map of her target area, and we put those maps on top of each other, and like, we're serving the same people. It was so suddenly clear, and it was like, we have to figure out a way not to be duplicative. So Kim and I sort of thought, well, it shouldn't just be Martha's Table and the Bridge Park. Who else should we bring to the table? And it was really clear that Bread for the City and bring George and Dion at Far Southeast. Let's get together. And LISC has been a partner with our equitable development work, committing $15 million to the immediate environs around the Bridge Park through our equitable development plan. So Ramon Jacobson joined us as well. But again, all of this started pre-COVID, and all of this was started primarily through a anti-displacement lens. I will say, it's hard to find a silver lining in COVID, but I think if COVID did not happen, I don't think this project would have happened. The COVID provided the impetus, it provided the catalyst, it provided the immediate emergency need for all of us to collaborate and pull together. I'll let others sort of take some of the other questions that were embedded there.
Catherine, do you mind going through that first question is what stuck in my head as well. Do you mind going through?
Yeah, just, you know, so some of the folks that are here are from other areas of the country that are very interested to replicate this. So unlike yourselves, who this is like your professional work and you kind of are deeply embedded in these networks of agencies and conferences and everywhere else, are there, you know, if people were looking for, you know, agencies, researchers, you know, in other parts of the country, are there any places you would kind of point us to look at, like particular conferences, particular research labs that kind of study this broadly, you know, just to kind of point people towards where they might find local organizations like yours, but in other parts of the country?
Yeah, I think that.
Go ahead, Mary.
The mayor's guaranteed income website is a treasure trove. Stanford has a basic income lab. A lot of people are starting labs on this. I'm even in discussion with some folks at Stanford, or not Stanford, Aspen, and the Jane Family Institute. They're the researcher that's underlying Compton. And we're talking about how we could pivot off of things like the work Jane Family Institute's doing and Urban's doing with Thrive and Jane's doing with Compton and other sites, to talk more about exactly this issue. Like, can we have a little community of practice that would go into what would it really take to make a transition from our very siloed social services system where the benefits are in the way, not so beneficial in many ways, in terms of not really letting people get ahead. And how do you move through that system without disadvantaging anybody on the process, to a system where the income really was guaranteed and not fragile. One of the things I've heard a number of very august researchers, like sort of, old timers in the profession, express real concern that something like food stamps would be replaced by this, something like this, because they feel like food stamps, for reasons of interest groups protection, are protected at least. And we do see 3/4 of the people on Thrive are on food stamps. Whereas, as beneficial as a Thrive is, would it be more vulnerable to being cut politically? If it, how do you protect something? Part of the answer is you make it universal. That's also a means of it, because then people want to protect it more. And so then how do you make it practical from a fiscal perspective? And so there's a whole bunch of transitional questions that I think some of the researchers that are in this already want to organize with practitioners like you guys to discuss more. So there's another thing even this group hasn't heard me talk about before yet, but it's a conversation that I'm having with the Aspen Institute people and the Jane people.
Yeah, and I'll just toss out, I think, for us also, this is a community that we are wanting to find and build. And I'll just sort of share as well, in terms of resources. One of the projects Mandy has been working on and helping us with is actually compiling all of these, various groups who are doing this work across the country, because it is really taking off, but there doesn't seem yet to be a real centralized place. And so, Mandy, I'll sort of offer your work to the group. I hope you don't mind. I think that's also, like, once we build that, that's certainly something that we can share, because we're also looking for that community and group, and are excited to be a part of it.
Yeah, and I would see it going hand in hand with the field guide we'd like to produce, is sort of that's why we've been talking about almost like a community of practice, is like, get folks like an Aisha and Aaron Doro and Magnolia Mothers Trust, folks like this that are on this call in the same room as researchers, to really kind of just have good conversations about what it will take to move this work forward. And beyond being just pilots, because I've heard that talked about a lot recently, is that there's a lot of pilots. And there was even an article on some channel recently, that this is the year of the basic income pilots. Great. We're at the leading edge of that in some ways, or part of that stream. But how do you take all these lessons learned and turn it into a real corpus that could move policy forward? And again, that's one of the reasons I have my colleague Elaine Maag here, because with the Tax Policy Center, it's going to come back down to things like tax policy. And how what a sophistication about how these systems work, and can be worked with even now. So we're all ears. And all that is to say, if folks want to continue talking about this and some of the, put the conversations together, I know we at Urban would love it.
Nice. Elaine, did you want to kind of speak to any of that?
No, I think Mary's covered it. Thanks.
Okay. And then I guess there's a question for maybe Urban, because you were talking about the community researchers and just you're looking at this. Like I know one of our chapters, they kind of started this conversation in Kentucky, and they had gotten some local folks to commit to I think 1.5 million, and they were kind of looking to the Stanford Basic Income Lab and also their universities in Kentucky to kind of figure out some of the stuff that you've already figured out, which is how do you pass this money to people without disrupting essential programs for them. And then also when people are unbanked, like what is the way that people can get money. But I guess I'm curious how, like if they could reach out to you to kind of get some of your training materials for the community researchers, because that sounded very exciting, or if, you know, you all are interested to pass that, if there's like an ability for the program to expand just kind of beyond the DC area. Like, I don't know what capacity the Urban Institute has to start kind of watching some of these programs in other parts of the country.
You know, I'll be honest with you. I don't know. Even as Elaine can attest to, Urban is an extremely entrepreneurial place. So we just decided we wanted to do the community researcher piece, and it goes along with a big movement internal to Urban on community engaged methods in general, where you have these, you know, community advisory boards for research. For Thrive, it made sense to take that a step further and say, look, we're just going to make people our colleagues. And it truly, the training was lovely on that basis, because there was a real sharing and just such a great interest from the folks we worked with. So, I mean, I would be happy to share those training materials. You get into a whole bunch of IRB issues for folks who are in research. Be aware that it hasn't been a simple process behind the scenes, but it's a very rewarding process in the end, because I think we're building something that can be a gift that keeps on giving, even back to like the Bridge Park evaluation, things like that. So capacity to work with others and to get, I mean, what we have capacity for, I personally do, and I know Elaine and I have been talking about, is to continue moving forward with this Aspen Institute. And it's the financial securities practice area for them, and with the Jane Family Institute. Because I really would like to see a practitioner researcher group moving forward where folks find their own partnerships. Urban doesn't need to have capacity to get into all of it. What we want to do, and again, this is the acting with integrity part that is core to Thrive values, is, you know, how do we spread this, literally spread the income so that we can spread the wealth? Because we know that's in the end the challenge we're facing is things, especially to the extent that this project is so much about closing a disparity gaps that COVID, you know, has just making worse. It's also ultimately, how do we get into issues like closing the racial wealth gap and things like that? And how does this contribute to that? And creating sort of a theory of change and logic model around all that is of great interest.
All right. I saw a question from Keith earlier. Did you want to pop in?
Sure. Yeah, thanks very much. This was super informative. So I had one question. So I was watching a interview that Andrew Yang did at the Old Fourth Ward Atlanta Economic Security Task Force. And a question was posed to him, kind of like how you know, how pilot programs could kind of be developed, you know, throughout the country, and what his thoughts were there. And one of the things that he mentioned that I thought was interesting is like the idea of potentially like pairing, you know, kind of like philanthropic sources of funding with also like public funding. And so he said like a good action for organizers to take might be to kind of exist or find existing like what he called like anti-poverty kind of like pools of kind of like money within city or town budgets, and then like make the case to the leaders within that city or town that starting a UBI pilot would be kind of a good way to use that that pool of money. So I was just like kind of wondering your thoughts there, or if you tried anything related to that, or done anything related to public funding, because I know like especially on the state level, there's this big question of like where the money can come from, and ensuring that a balanced budget exists and whatnot. So just curious. Thanks.
So I would say that would be such an advantage if you can hook up with a public partner, because when municipalities or states or the federal government give out money, they get to make rules about how other programs treat that money. And so, for example, all those economic impact payments that went out from the federal government, they didn't affect anyone's Medicaid or housing or any of the issues that Tracy brought up. They can give waivers to programs to say your special program doesn't count. And private sources, it's very difficult for them to get those kinds of waivers. So they're always going to be fighting these structures that exist, and you end up spending a lot of money just replacing benefits sometimes, instead of actually providing the lift that would be meaningful to people.
Wow. And
Go ahead.
Yeah, I could not agree more. Yep.
I'll add that I think built into, one of the things that I think is so great about the Thrive model, as Vaughn described those components, is that this alleviate crisis and is very much about the cash. The second goal, stability, is very much about connecting people to public benefits, maximizing those. So Far Southeast, which is a partner that's not here tonight, they're doing, in addition to the community researcher training with me, one of their special roles in the initiative is to provide service navigators to any one of the now 353, soon to hopefully be 500 families who want a service navigator. And so when Elaine and I look at that question of why is the unemployment insurance benefits uptake so low, we're going to be going back to, we have a data sharing agreement with Far Southeast and that we're starting to activate to look at that data, is like, as they've worked with people in service navigation, what have they found? We'll collect some data in our qualitative, but that's how we're going to answer that question. And again, it's putting together every family's pie, right? And not taking out chunks, like replacing one piece of the pie with another piece and knocking out, what's there already. And again, that gets to larger policy issues. So all of this, the pilots will take us a long way in terms of learning. I think one of your questions too was like, how do states do it? I think ultimately it's going to have to be federal coffers get behind this. That's where the money's going to be. But unfortunately, the politics aren't very good for that, right? Today notwithstanding, again, we'll see what changes over time with some of the shifts we're already seeing.
I was wondering, Melody Webb, since you're kind of actively working on this in DC, were there any questions that you wanted to raise or suggestions that you wanted to put out there? To give you the floor.
Sure. So my goal is really twofold. We're really interested in learning more from others who are either currently operating a pilot like you all are, and it's just fantastic, as well as those who are in the planning stages. And that's in DC and possibly in the region. And we also, through our nonprofit organization, Mothers Outreach Network, are very interested in and actively exploring starting a pilot and, seeking funding to start a pilot for a very particular group of marginalized mothers in DC. So, just my general comment is that, we'd love to see, learn from, partner with other organizations, and really just see these pilots grow into sort of, publicly funded program. And so, I'm just want to make that point and hope that we can continue to talk, having met members of this Thrive DC, just hope that this is the beginning of, further conversations. Our focus specifically is on mothers who have been involved in the foster care system or whose children are at risk of being removed from their care. And we, in particular, I have practiced law as a child abuse neglect attorney representing parents, and for years have, had this strong concern that ultimately the families or the mothers who are at risk in large part due to poverty, and the intervention of, sort of infusions of cash as well as some other supports could very much be a preventative measure. And so I'm also looking specifically at programs. I think there's a program in San Francisco that is targeting Black and I think it's Samoan mothers of East Asian descent, and also Magnolia Mothers Trust. So, I'm just really eager to learn more and hopefully get some support for our pilot idea. What I had done was I sent a message, I think Karen mentioned, and you all at Urban Institute, I'd love to talk about a survey tool that we're developing to actually gain input from the mothers that we're interested in working with, as to, like what sums of money actually make a difference in people's lives, looking at some just sort of general research in Canada. I think there have been programs which, apparently have provided for multiple years sums as low as $200 per month over years that have made a significant difference in the lives of lower income people. So have lots of questions, lots of thoughts. And, I too hope that there can be some convening of groups of individuals or organizations that are interested in all of these topics so that we can, just get some, good programming started in our respective communities around the country.
Great. Scott, it sounded like you were the one who was kind of dealing with the funders. Wondering if you could maybe offline of this or in here kind of just share some of the kind of data that you were showing people to really convince them that this direct cash was the way to go. We're definitely trying to build a data portal to allow us to have conversations directly with legislators and others to really show that trusting people with money and making their own choices is superior.
Yeah, we'd be happy to share our 3-pager blurb that was much of this was, pick your metaphor, like building the plane as you're flying it or riding the bike as you're building the bike, as, we were just we knew that the need was the really intense, and we're putting all this together fairly quickly, but we'd be happy to share the little blurb, the 3-pager that we created that outlined the need, the audiences we're serving, the unique, I think one of the things that we've touched on is that each of the 4 different nonprofits had, and Tracy touched on this, had a very specific, and we all do a lot, but has a very specific skill set. So each of us brought a very unique skill to the table, right? Martha's Table doing all of the food and dry goods, and Bread for the City providing the all of the financial, the cash transfer, the back end services, as well as the legal services. Far Southeast, the providing all of the Navigator, the work. Bridge Park, the connecting, sort of assembling folks, connecting to the evaluators, working on some of the communications and the website stuff. So we'd be happy to share that, and doing it over, we might have done things a little differently. So happy to share, anything that we tweak and do a little differently. Okay. So just feel free to go ahead and I'll put my email in the chat and go ahead and ping me, and I'm happy to sort of send that over.
Awesome, thank you. And for the Thrive program in total, we have kind of growing chapters in the DMV area. Is there anything that we could do beyond helping you fundraise? Obviously, that's not our strength yet, but are there any politicians or any ways that we could advocate in support of the work you're trying to do? Just any ideas you have of, how could average people support you in, your work going forward?
I threw out one item. I think just that, I mean, one of our main goal, of course, was providing the immediate assistance to families in need, right? As you're hearing, and I think is evidenced by this conversation tonight, another key goal was how do we learn from this pilot and working with our fabulous evaluators at Urban to really, as we have learned from our colleagues around the country, how do we push others further up the learning curve? So I think continuing to reference sort of Thrive is particularly with municipal officials, and particularly DC municipal officials, I think is really helpful. I mean, the Bowser administration has been very aware of this work. The Deputy Mayor, John Filciccio, has had many conversations with several of the executive directors. They're trying to figure out how they can help. I think they're caught in a little bit of two bits of a bind. One, it's a really tough financial situation for the district. And two, since we're so targeted geographically, it's are they opening up themselves they're helping Ward 8 residents, well, why not Ward 7, Ward 5, whatever, at least that's some of the feedback that we've had. But I think any sort of sharing with council or, administration, the folks in DC that this is something to be applauded and expanded, because I think the only way that, this is a pilot and it's great we can do this for 500 families, but if we're really building it to scale, and I put this in the chat, we need local, state, federal funding, right? That's the only way that and for the other reasons that Elaine mentioned, right? They're the ones who can really tackle some of these benefit issues. So a long way of saying, sharing this with, hey, you should, if you don't know about this, the city council member, administration official, this should be on your radar, and this is something to watch, and this is something to expand. I'd welcome my colleagues for chiming in on other ideas.
And I think Scott alluded to this, but I'll say that especially as we've been doing this upcoming brief on the fundraising, and you may ask, like, why is the evaluator looking at the fundraising? Well, because it's a big deal, and these programs are not cheap. So it's important to the implementation study in general is to say, okay, how did this money come in and what really promoted it? So even if you guys can't help with fundraising, I bet you could help get media attention. And the bounce that you get from the media attention, especially in individual donors, there's a real sort of story. And I've been talking to our chief philanthropy researcher about this at Urban about, the sort of trend towards individual level giving in the country in general, sort of the GoFundMe trend, and how things like the pandemic and what I talked about, that people see these news stories and they go to that website that, in fact, Megan just donated, and I think, what is it, Scott? You've got like 130,000 through the B-Bar site now, right?
Yeah,
that's a lot of donor
and we just had an article come out over the weekend, and we just had an article come out over the weekend, and we're seeing another spike. So
yeah, big spike. I know just even sharing it on my own Facebook page, I had people asking, oh, this is what we think, and it's amazing when you get to those individual donors through media, how this captures people's imagination and attention. Because people know in their bones that these values are the right values. Like, why are we making people jump through all these hoops? When in fact, you can see, and Tracy was sharing a story yesterday about how, there's people who think folks who are lower income are not honest with these kind of benefits. Actually, they're so honest that they want to report the additional income. And then that's when the lawyers for bread have to advise and write letters and, to protect their benefits they have. There's something crazy about it, actually. We got to untangle this system. Not a good system.
Let's see, have I missed any other question? I think, Karen Lynn, you had a question earlier in the chat. Did you want to kind of raise to folks?
Hi, yeah, sure, thank you. I just wanted to say hi, and that I'm a qualitative researcher from in the tech industry. And I'm just wanting to see, are there research methods from tech industry that, excuse me, could potentially help out and kind of just tech in general, like if there are any thoughts you guys have in terms of like, gaps in, the way people have access to information online, or kind of what's needed from that perspective, if anything at all.
We should probably talk more, Karen, and maybe, look at what your thoughts are, because I'll tell you the digital divide issues have been pretty deep in this. I mean, that's been talked about by Vaughn and Tracy, and we documented it in some of our work so far that, and I've been involved in things like Promise Neighborhoods, where the big issue was, do families have PCs? And then now we've moved to cell phones and all the different channels and, fintech and people's ability to manage fintech, and who knows Venmo versus, actually we've got some workarounds going with that. I mean, there's a whole story underneath this about tech and fintech. So I'd love to have a conversation, maybe with you about your thoughts about that.
Yeah, that'd be great. I have my email in the chat, so please, feel free.
Great.
Yeah, and come back and let us know what the outcome is. I know earlier in the year, like Humanity Forward was giving away $250 micro grants, and it was just so hard to send people money. It's such a complicated thing. And then you're talking about, in addition, that, how it impacts people's ability to stay on the programs that are so essential to them. So yeah, just kind of circulating more widely, like, what are the options, that, because I think everyone has those same questions.
And Tracy, am I correct in thinking that from all the research that your benefits attorneys did, like the two biggies, right? I mean, just to sum it up, is SSI, disability, and Medicaid, right? I mean, those are there are SNAP, TANF that you can get on, you can get off, and is there a value if you're? I mean, one of the suggestions I think the benefits attorneys had is take the lump sum, right? Because then it's going to impact 1 month. It's not going to impact 5 months of eligibility. But is that fair to say, Tracy? Or did I?
Yeah, I think that's a fair summary. I mean, the attorneys obviously would say, it's very specific to each individual's very specific situation, but in general, yeah, losing things for 1 month.
And reauthorization of housing vouchers. Yeah.
Yeah,
exactly.
I would say the Medicaid and housing
piece. Yeah, like what Elaine and I have had a lot of conversations about the housing vouchers piece, like. And COVID is creating a context where it's harder to tell what's at risk and what's not at risk right now. And something like the certification periods of housing, I worry even for the community researchers, like, we're not going to be paying them enough for these interviews that they're going to be doing and stuff. Like, we've already warned them, we don't want to go over the $600. So this is really very much a small level consultancy now. But if they were to have other money, and we know a number of the community researchers have already said they have housing vouchers or they're in public housing, is that going to affect their recertification? That keeps me up a little bit at night.
Which is just so screwed up. Sorry, I know I'm preaching to the choir, but it's like, it is so the embedded systemic racism that is like so intertwined in all of our systems. But
yeah.
And Megan, did you have a question you wanted to raise?
Oh, sorry, I was double muted. I know we're close to the end, so it's not like crucial if everybody has somewhere to be or to jump off. But my question, it's a little kind of, I guess, in another direction than what a lot of the conversation is. It is and it isn't. But obviously, like, the ultimate goal is universal basic income, at least for me. And these programs are not universal at the moment. And this is just like a curiosity. I don't know if this is something you're looking at or you've seen the results from, but there's definitely people not in the communities, not in the program, not getting these benefits. But are you seeing like kind of a ripple out effect of benefits to other community members that are in the same community as your recipients, but aren't necessarily your recipients, if you know what I mean? Am I wording that in a way that makes sense?
Yeah, I can speak to that. I think even in this article that Scott mentioned that just came out, we had one participant who is literally taking all of the funds that she can get to Uber to help other residents. And so that's just one example. You know, a lot of these participants are taking the funds, and these are people that are oftentimes in extreme need, but they know that there are other people that are in as much need as they are or more. And they are taking these resources and just using them for philanthropic efforts to be able to support other people in their community.
Speaking of other people in the community, what percentage of, you know, like how many people like live in Ward 8 that would be in need? I mean, are you guys serving even close to 1%, or is it just like such a drop in the bucket? Okay. Yeah, that's what's amazing.
Yeah,
It's like it has to go to the federal level because there's no money otherwise.
Yeah, in
to handle it.
the interviews we've already had with philanthropy, or folks are saying, boy, you know, we can step up this much, but we can't keep doing the amounts even to Thrive has raised, because it's in a unique situation that they, you know, the COVID drove it. So this is the thing, is I think the sustainability story, and how you think about, and this is why I keep mentioning targeted universalism, is I think you should offer it to everybody. And then what Thrive is doing makes sense. Targeting to Ward 8, a disinvested community, and then not putting any more, like, I'm not even sure if I were, you know, to go back and I had a say in it, I might advise the CBOs not even to put the 50% AMI gate on it, and just let it be like, these are our clients, these are who we think need it most, and it will be, we'll give to them, and then when we get more, we'll give to more people, or we'll continue, you know, so that it really is that there's just as few eligibility qualifications on it as possible, in order to remove any of that. But it's a drop in the bucket.
And I know when the first Washington Post article came out in June, we were really flooded with calls of the of you know, really deserving Ward 8 residents that our 4 nonprofits didn't necessarily have any connection to them, not necessarily weren't serving them, so they didn't fit the criteria. But I mean, we quickly pulled together a larger resource list. So who's handing out food, and here's other places that you can get, you know, X, Y, and Z. But yeah, the need is so outstripping the little drop in the bucket that we can provide.
Well, and the stories we're hearing already from the partners, and that we're going to start our interviews around, is it's kind of heartbreaking to hear how many people cried when they were called. And Vaughn and folks know, since you guys made the calls directly, Vaughn made a lot of those calls, and just sort of the disbelief too. I mean, Vaughn, you got people who thought it was a scam.
Yeah. Yeah, I mean, I will underscore that. And I know Scott doesn't mean it in this context. Like, it is certainly a drop in the bucket. However, for the families that we are able to help, it is not a drop in the bucket. Like, it is extreme support. And to Mary's point, like, where like a lot of these experiences have been very emotional, you know, when you're telling folks, no, it's real. Like, I'm not out to get you, and they're actually getting this money in their hands. It's really,
they don't have to do anything. I get that question all the time. What do I have to do?
Yeah.
Yeah, I want to be respectful of everyone's evening, so kind of let you go shortly. But you know, it just seems like we need to, because we're working in partnership with Income Movement, Economic Security Project, and others to kind of really do some lobbying and congressional pressure to get them to turn on, you know, first just, you know, 6 to 12 months of, you know, recurring cash for everybody. And that's a huge stretch goal, but then to convince them of, you know, that full UBI and a floor, and really coming out of the federal government, you know, is really the only purse that has any possibility of doing something like that. And just the second order effects of how that would unlock so many things. And so I just wonder, like, we had seen the Inherent Good film that was following the Magnolia's Mothers Trust. Like, was that ever a consideration that you had to, in some way, you know, there's so many questions of how to do this respectfully and with full participation. But, you know, sometimes in making these documentaries, it really does, you know, open a window. So just, you know, you were talking about media being one way, you know, news coverage of it. Did you guys ever consider, you know, having any kind of documentary piece to it, like either people self-recording or, you know, whatever?
Our Southeast Family Strengthening Collaborative is working on a short, like 10-minute video on this. It's still in the sort of editing the phase, but where they've interviewed a lot of the families directly who've been impacted, as well as many of the NGO partners. So as soon as that's available, we'd love to be able to share that with you.
That would be wonderful. All right, does anyone else have any questions that they want to ask quickly before we have to kind of close up? And I think this is like a pause to the conversation rather than this is the end of it. Like, we're definitely looking forward to supporting you guys and coming back and learning more. And I know we have data portals where we're trying to build up these resources and turn our congressional pressuring, use these conversations to inform our conversations with our members of Congress to, you know, try to build more support for this. All right. Seeing no further questions, and we're about 15 minutes over, I want to thank all of our guests for spending your Wednesday evening with us and sharing your research. And it's just opened up so many questions. And, you know, we'll definitely, I see a number of people that will be kind of reaching out, and very excited that Mandy is kind of connected with us. And, you know, through her, we can, I think we're definitely going to share this recording to a lot of people who were excited about it but couldn't come tonight, and we'll kind of collect a set of questions and like send that across again and keep this conversation going. So thank you to everyone who was here with us this evening, and I'm so glad for the beginning of this. So thank you.
Good night, everybody.
Thanks so much for having us.
Thank
Night.
you. Good conversation. Bye-bye.